Welcome back, Warriors and Sporters, to a bonus episode for Awareness Month. I have today with me all of our volunteers on our team that are also warriors. We have with us Jennifer, Yesina, April, and Beth.
Thank you for joining me, ladies. We have so much to talk about. Where do we want to start?
I guess maybe how we started with CRPS or what got us to the diagnosis.
Great idea. Jen, do you want to go first?
So with myself, I was animal control officer and I got bit on my left forearm. I developed a soft tissue crush injury and compressed my ulnar nerve, which is the peripheral nerve. I never knew that. Shortly after that, I started having severe pain that I couldn't distinguish why. Anytime I would touch things, it would start to hurt. On top of that, my swelling never went away. And then it just went from there. I got diagnosed like at the 3-month mark, and I officially hit 3 years with CRPS on 10/15 of 2024.
I could go next.
Awesome. Go ahead, April.
My journey started with an injury when I was in 5th grade. I fell at recess and hit my arm, and hyperextended the elbow. And from that, I was misdiagnosed as having a broken arm, and so I got casted. I wore a cast for 2 weeks and started to notice weird sensations. And when they uncasted me, they let me know it wasn't actually broken after all. Despite not being broken, all of a sudden I couldn't use my arm due to nerve pain, and I was unable to straighten my arm for a year and a half. Fortunately, my arm went into remission, which was a big blessing. But around that time, I injured my knee at a swim team practice and at the age of 12. And unfortunately, that one also developed into CRPS. Essentially, it affects my nervous system all throughout my left leg. And pretty quick after that, it mirrored into my right leg. So now I have CRPS in both legs, and I've had that. I'm 27 years old, so since I was 12. So it's been a journey that affects my mobility, my reaction to other small injuries, and just overall pain levels.
Thank you for sharing. Yesina, do you want to go next?
Sure, I'll go next. So I got diagnosed when I was 14 years old. I was always involved in sports, cheerleading, cross country, soccer. And one day after school, I went to my mom. She picked me up and I was like, "Hey, Mom, something's not right. My leg is not supposed to be this color." So I showed her and it was turning purple. It was getting frozen cold. She rushed me to the hospital. When I got there, I couldn't really move my leg at all. And they basically said that they felt like my foot was soaking in ice bath water because there was no pulse. They couldn't find anything. And they're like, "This is not right." They kept me in the hospital for about a month. And then one day a doctor came by and physically got out a book and started reading off my symptoms to diagnose me with CRPS.
Oh,
So I've been living with it since 2014. I was 14 years old. And I went through my whole life, did college, working full time, but there's good and off days, but I'm continuing to live with it, continuing to overcome it.
Thank you so much for sharing. Beth, did you want to go?
Yeah, I'd love to share. So I was diagnosed roughly 4 years ago. I was 14, and the pain actually started whenever I was 13. Was a gymnast. I did soccer, and I was doing gymnastics, and I did an aerial the wrong way, and I fractured my growth plate, which also affected all of the nerves in my left leg. And so from there, I went from having a fractured growth plate. They booted me, and I was on crutches for 5 months, and I was in a boot for 8 months. I was jumping around from doctor to doctor. I think I visited over 20 different doctors in my area. No one could diagnose me. I went back and forth for a year doing this. And then finally we were doing research, drove almost 2 hours to go to another doctor. And he looked at my purple, green, blue leg and foot and he said, "You have CRPS." And he was like, "This is what you have." So I was diagnosed after a year of having it. And he was like, "No, we need to start going through the process of trying to get you help, trying to get you into remission." Unfortunately, I'm still not in remission, but my doctors still have a lot of high hopes for me just because I am still young. I'm 18 now. I've been living with it for almost 5 years. And it's definitely been a journey, but one very big thing for me is I love to be active. So it's hard. It's definitely hard, but sometimes like it's just like my brain pushes me to my limits sometimes, but I never try and let it stop me from living my life to its fullest.
In my case, my journey started in 2020 with a dog bite. Following that incident, I had various things happen that I just couldn't explain, like extreme random muscle spasms and times my hand would lock, not gaining full rotation back. I had never went to the doctor for this injury, and at the beginning I knew it got infected. I was able to get that under control with the antibiotic, but that's the reason why I never really thought anything of my symptoms, that it was just a complication because I didn't get proper treatment to begin with. Then in December last year, I woke up one morning with a full flare in my left foot. It started with the discoloration and extreme internal pain that felt like inflammation, like my leg was just going to rip open with how much pressure was in there. As it progressed, the hypersensitivity to touch came about, and I couldn't even put a bed sheet on top of it or have it brush my foot. And then it turned to the worst part. I got up to go to the bathroom. Not thinking anything of it, I tried to walk and immediately was on the floor. Now, this being about 2 days in on the flare, I had first went to virtual anywhere care, who sent me to urgent care, who sent me to the hospital, who then had me have a follow-up with my PCP. The one commonality they all had was they had no idea what it was or what to do with it.
I finally got the help I needed because I asked for prednisone. With my boyfriend having full body CRPS, I've been around it long enough and have taken care of him. So I thought that was what it was. And I took the antibiotic they gave me, which made it worse. And then said, I'm going to ask for prednisone. If it works, then I know what this is. And then in January, I got diagnosed by the same pain management doctor that Brian has here. It's definitely been a very unique story in having the perspective of a caregiver and then as a patient.
For any listeners out there that don't know what complex regional pain syndrome is, it is a long-lasting pain and inflammation triggered by trauma, injury, or a medical event. It's characterized by pain that is greater than would be expected from the original injury or circumstance that caused it. CRPS can affect, spread to, or occur anywhere in the body. However, it's usually the extremities that are affected. This condition is nicknamed the suicide disease and is the most painful chronic pain condition known to mankind, coming in at a 46 out of 50 on the McGill Pain Scale Index, which is higher than childbirth or amputation. There is no cure. Most treatments are geared towards symptom management. CRPS affects every patient differently, and every patient responds to treatment differently. The one consistent thing this disease seems to have across the board for all patients is a constant and persistent pain that does not ever subside.
Now, we mentioned some of us have been in remission and some of us are still working to get there.
But everybody here is pretty optimistic, right, ladies?
Try to be, yeah.
Times that I'm hopeless, but there's other times that I'm really optimistic.
How important do you think that optimism is?
So my psychiatrist told me that it is very important to be optimistic and to stay positive because CRPS also affects our depression and anxiety a little bit more. So they said the more happy thoughts we have, the more likely we're going to stay positive and keep moving forward.
One of the biggest hurdles is really just discovering who this person is now. CRPS really has a way of taking who you've always known or who you've worked to be away from you. And for some of us, it's really hard to accept, like myself, that are very stubborn. It's very hard to accept, and we want to fight it. And I think that that's good when it comes to trying to find treatment and keep trying to get to remission. But I also think it can be very defeating in a way, because it also can put us in a place of like denial of what's going on with us. So I think that that's really important to really be aware and be able to
You're doing
stay
great.
positive. Yeah, I know. My brain just completely put for a second.
Oh, I feel
Another
that.
lovely symptom, right? Lovely
Yes.
brain fog.
Oh yeah.
Actually, I think that's the hardest part for me, was the brain fog, because I used to have visual memory, photographic memory, and I could remember conversations verbatim, right? And could rehearse it right back to you. I could remember everything. Now, if my head wasn't attached, I wouldn't remember it.
Yeah.
But
I
it's
absolutely agree with that. I ran a 7-doctor practice and I took care of all my clients and their dogs and their medications and everything that I could possibly think of. And now I can't even talk and do something at the same time. I can't multitask anymore. That's completely out the door and out the window. And I don't expect it to come back. I hope it does, but it hasn't come back at all.
does everyone else have trouble multitasking?
I definitely had a really big problem last year, my senior year. My brain fog was getting really bad, and this was a point where I was starting to lose mobility in my ankle and foot again. And my doctors were like, let's try some different medications, let's try some different things. But my brain fog was also getting really bad, and it was actually like affecting my grades in school, which was crazy because I'm a gifted student, gifted in the term that I learn a little bit different than others and I might learn a little bit quicker. But then that kind of like pace that I was used to started to slow down a lot because of my brain fog. And it was really hard to deal with just because I was so used to being able to learn things really quickly and pick up on things really quickly. And then all of a sudden, I just couldn't. And it was really confusing. And it was like, I've been dealing with this kind of thing for a couple of years, but I didn't know that at the time. I didn't know that the brain fog and the kind of just things like that that are not maybe a part of my leg or a part of my foot, but they're still connected with all the nerves. And I had no idea that was going to be like a symptom that I would have.
For me, with the brain fog, I feel like I was very a type A person, always had a list organized. I was able to do, okay, I need this at this time, this at this time. Now, if I do something in the morning, I'll completely forget about it. And I'll be like, oh, shoot, there was something I needed to do, but I don't know what it was. And it'll go the entire day. And I'm like, guess we'll figure that out tomorrow. Because
That's
it,
me.
it is so weird because I was so used to being a scheduled person, being everything, okay, this needs to be done here, this needs to be done like this. And now it's, if we get to it, I guess we get to it.
Yeah, it's interesting because I was diagnosed so young when I was 11. It's like it's good and bad that I don't remember a whole lot of how life used to be before this, which I do remember some things, but it's just always been how I've been. But I will say, I do notice when I'm in a flare how heightened my brain fog gets, or just my ability to focus on anything else other than the pain, which is frustrating because sometimes you feel like you're like, go, when it comes to any symptom too. And then all of a sudden you're in a totally different spot, you're in a flare, and you're like sitting at the computer working so slowly. And you're like, just last week I could do this in 10 minutes. And here I am trying to do the same task and it's taking an hour because my brain can't focus, which is that similar scenario where you're losing something that you're capable of without this persisting. But yeah, I definitely can relate to that.
Yeah, and hand in hand with that, I lose track of time. My daughter knows that if she needs me to be there, to tell me to be there an hour before I'm supposed to be there, because then I'll be there on time. I realize I run at my own speed and it takes me a lot longer to accomplish things, but I don't have any concept of that time frame that I'm doing it in. They'll tell me, "Oh, that took you 2 hours." I'm like, "No, it took me like a half hour tops." And it used to take me a half hour. And I think too is that the brain's not catching up. I noticed with Brian at first and now with myself that I tend to still view myself as capable of doing and being the way I used to be. So if I were to describe myself, it may be very inaccurate.
And that's another area that's hard for me because I have always had to be a person that is super self-aware due to my mental health being medication resistant. I've had to learn how to cope and have strategies and skills to manually regulate my emotions and to challenge my thoughts and turn things around for myself. And CRPS has made that task a lot harder.
I was curious if you wanted to talk a little bit about comorbidities. I don't know if anyone's comfortable with that. And I don't know if anybody has any comorbidities or not, because I know that this is a full person disease and illness. And for me, I had and started with severe mental illness my entire life. I have severe ADHD, I have complex PTSD, and some other things as well on the mental health side with the anxiety and panic attacks and things like that. And then this past year, I also found out that I have a brain malformation, which is its Chiari malformation. So that's also a big culprit to a lot of my nervous system issues, along with the dog bite with my ulnar nerve, and then
It's just
having
like
the
me.
hypermobility. Yeah,
The owner
yeah,
knows that down
yeah,
there.
yep, yep. And then having that I have that also hypermobile joints. So all these things are it spread to my foot. I fell asleep with my ankle not in the socket, dislocated while I was sleeping, and it spread there. And it's just, I know that it has substantially affected my mental health and my ability to control it because it's medication resistant. So I have to control my mental health. And it made it a lot harder to be able to do that. And it's made it, I think, harder to accept things like the malformation. This is part of CRPS too, is doctors miss things and they don't find it or they deny it. And it's the malformation. I was born with that. You're born with it. And I'm 38, just turned 33. They found it at 32. And it was a doctor that looks at things differently and he found it right away. I'm just interested to see how all those things interplay, if anybody has those and is comfortable talking about them, because this is a big area of needing awareness. Doctors want to diagnose things based off of somebody that doesn't have this illness. When you have CRPS, it amplifies everything. And people that have this shouldn't be assessed by somebody that doesn't have its standards. How many times I've heard it's not bad enough yet is really honestly shameful. And I just think that's a really big key point. I don't know if anybody wants to share about any of that. Don't feel like you have to if you don't want to. I just threw that in there because
No, it's important to talk about it. Like, as for me, I have always been like high functioning. I had a little bit of depression, but I was always high functioning. I was animal control officer, so I worked 10 to 12-hour shifts. I'm a mom of two, and I was a teen mom, a wife, and I always was able to handle things that were thrown at me. And I had severe trauma when I was a kid, and I was able to handle that. I did the work, and I needed to, I did everything that I needed to do to get myself to this point. And then when I got CRPS, it just derailed all of that work that I did. And the first year I fought it. The first year I didn't want to accept that I had CRPS. Sorry. I didn't want to accept that I had CRPS because to me, it's like they were telling me, like, hey, you have to get used to this. This might be it. And I'm like, okay, I wasn't accepting it. So the first year I fought everything. I did acupuncture, I did everything that I could do, but I was fighting my medication. I was fighting everything that I didn't want to accept it. And I kept pushing myself because I've been in track, I've been in soccer, I've done so many sports and I pushed my body to the maximum that I could push it. And this is not something that you can do that with. And I had a hard time understanding that. I had a hard time understanding that, hey, you got to stop. It's okay. Stop. So I had to go to therapy. And with therapy, he taught me a lot of people are afraid of therapy because you think, I'm not crazy or I don't need that. But it's so much more than just an injury. People don't realize that you lost a part of you and you go through grief and you go through all sections of grief. One day you're happy, one day you're like, hey, I got this. And the next day you're like, hey, I don't got this. So this last year, I started having a harder and harder time with it because my CRPS hasn't been controlled enough to where I can know how to live with it. So it's been a constant severe flare. And then I have a good day. And then because of my medications that I'm not used to, I start having stomach issues. I start having immobility issues because my whole hand swells to the point where it goes all the way up to my neck now. And I lose hearing, which nobody talks about. And I started developing arthritis. I started developing degenerative disc. I started developing all kinds of extra things that I never thought that I would have because I've always been a very active person. And now I can't. I tried swimming. I tried doing all kinds of things and my hand just wasn't taking it well. I started getting really depressed. I started getting really anxious all the time. I never had problems at hospitals until I had a horrible experience. I'm on an opioid that is for the brain because most CRPS patients, we cannot just take any opioid. We have to have one that's specifically for the brain and the brain receptor. I'm on a higher medication than most people starting off. And this is me starting at never having medications every day to having hardcore medication that I have to take 2 to 3 times a day. That on itself was another whole obstacle that I had to go through because I have 2 boys and my kids were 3 and 4 when I got hurt. And now they're 6 and 7. So I take them to school. I'm their full-time caregiver, even though I can barely care for myself sometimes. And nobody talks about that sometimes. I don't know how people do it. I don't realize like the medication makes you feel different. The medication that is supposed to be helping you doesn't make you feel like yourself. And then I had a hard time just staying still. I didn't want to accept that, hey, you just got to slow down. And like, I just kept trying to push myself and I couldn't find a in between. I haven't been able to find a medium because I'm workman's comp and they fight me every step of the way. So treatment that is supposed to be put together and that's supposed to put me into remission has been failed because workman's comp doesn't do anything to help me. They just see me as a number and they don't see me as a person. So all of my treatment was delayed. I missed my window of remission. It spread up. It was before it was at my fingers to my forearm. Now it's from my fingers all the way up to my neck, all the way down my rotator cuff. And it's starting to affect my back more on top of the arthritis that I just recently developed. And it's all been within these 2 to 3 years of me being hurt. And it sucks because the feeling hopeless started to really set in because I couldn't help myself. I couldn't help myself to the point where I can get myself up. I can get my kids up. And I had a hard time asking for help. And that's what therapy did. It helped me ask for help. It helped me slow down and understand, hey, it's okay. You don't have to do that today. And that was one of the hardest things for me, being really independent and just, I was a bulldozer before. I consider myself a little bulldog because that's how I attacked everything. I just went head on and I didn't ask any questions. But with this, it's every day is different. So it's a lot harder because you don't have a really spreadsheet. Nobody really knows how you're going to feel one day and how you're going to feel another day. And it sucks because a lot of times your family don't understand. A lot of times work doesn't understand. They just tell you mind over matter. And that's the thing. My brain isn't working with my hand. So it's not something that's easy. So that's how it's been for me. Now I have insomnia. I have depression. I have anxiety. I have CRPS type 2, adhesive capsulitis, degenerative disc, bulging disc. I just found out that I have scoliosis, which I never knew. And it started affecting my left leg. And I haven't been able to feel my leg for maybe 2 months now. And it's completely purple. It flares with my whole body flares now when my arm flares. And I never thought that I would get here. I kept pushing and I kept fighting, and not everybody gets an in between where we know how to live with it, because sometimes it's just out of control. And that's where I'm at. It's constantly out of control. My medications don't work. I'm scheduled for a spinal cord stimulator, but Workman's Comp has been fighting me for 2 years. So I'm getting to the point where they're like, hey, it might not work as effectively as it did with the trial. So I feel like I'm running out of options, but I know that I'm going to keep working and keep going at it. So that's what I've been going through with this. And that's everything that I've had to overcome with CRPS.
I think that even just your story right there, it really just shows how important awareness is with it. Workman's comp. Yes, they know what it is in name. That's it. But they have the ability to deny treatment that actually works, which blows my mind. But that they're allowed to do that to the
Yeah,
extent
because I
that
would have
they
went into remission too. I would have went into remission. We caught it at a 3 month mark, 3 to 6 month window, derailed me completely. They just pushed. And then we went to court and they're like, oh yeah, we approved this 3 or 4 months ago, but they didn't send it to anybody and didn't reply to anybody. And yeah, I missed my window. I definitely missed my window for remission because of workman's comp. And it sucks because they chose it for me and I didn't choose it for myself. And that's the hardest thing, I think.
I think that I totally understand that. And then when you had said that people don't understand, I had read this quote a while ago that I always really liked for this, and that is that people do not associate chronic illness with grief, but the realization that life will never be what it was in the future, will never be what you thought it would be, is a major loss. And it really is. People don't understand. We only know what we know. And it's so hard to get somebody to understand. Putting my socks on feels like it's excruciating, and taking them off feels like I'm peeling my skin off. Or my skin constantly feels like I'm waiting for it to break open. Or things that shouldn't hurt do. And I don't know for any of you, but I have had to tell every physician that I have seen this far what this is, except for a couple that I've researched and I knew did. And that is a problem. If I have to tell you what it is, how are you going to help me get better? Then there's the ones that just don't even want to really acknowledge it at all. And this is so defeating, I think. Insurance doesn't make it easy for doctors, but at the same token, that doesn't change the effect that it has on the patient. If you're on go mode and you accidentally gaslight your patient for the day. Okay, you were in the wrong and it was an accident, but how does that really affect that patient that's seen 5 other doctors this past month that did the same exact thing? Like you had said too, the the therapy is very helpful. This, like I said, this is a illness that affects every part of a person. It doesn't discriminate against anybody. It doesn't discriminate against any part of your life. And I think that mental aspect is so important, and it's also one of the things that's the most ignored. And that's also too, your body is misfiring, but what child is screaming the most? It's the pain. But the pain can change who you are as a whole. You can be an entirely different person. I don't know if you guys have this, but on a bad pain day, I'm a turd. You don't want to be around me. I may say things that you don't want to hear. I may say things I don't mean. I might yell at the dog more. It's just, but that's not who I am. But that's who the pain made me be today. And when we don't explain that to people around us, they just see somebody that gets upset over every little thing. And then they get annoyed with us. They're like, oh, here it is again. You better not let the wind blow this way or she'll get upset. And it's not that at all. It's my daughter at the beginning couldn't understand when when Brian would get upset when he would stub his toe or he'd step on a little pebble or something that the dog brought in. I'm like, no, Lily, if you were on fire running through the living room to get outside and you stepped on something that hurt your foot, you'd be that mad too.
Yeah.
Yeah.
And that she understood. But I think too is that it's the hard part of, we don't know how to describe it to people. We don't know how to explain it.
Definitely.
And this being so rare, I think too, is doctors don't see it all the time. They might see they see the person that doesn't know what it is that's scared in the beginning. Because the rest of us aren't going to go out to a doctor when we're in a flare. So they don't ever get to see the worst of the worst at times, or it's not as often, I think. And just that awareness is, to me, the awareness is the key to everything. It's the reason why there's misdiagnosis, why there's denial, why there's patients ending their lives. And
Yeah.
I just feel that this is so important to get out there from people that have this, and to let other people know you're not alone. And we get it. We've gotten chronic pain and we get it. And that's just the start. It's the start to change and being able to see a difference for everybody. Something I wanted to do, if everyone's okay, is I was hoping we could all say one thing that you wish a doctor knew or you wish your family knew. Just one thing as a patient that you wish everybody that wasn't could just get it. So one thing that, from Voices of Patients, one thing you wish somebody would get or hear you that you goes dismissed. And then something that really helps you, what being a volunteer in the foundation and giving back has done for you, to help other people have been where you're at.
So sorry that I talked so much.
No, hey, this is a room of no sorries, girl.
Yeah. It's just, but I did want to mention one thing before that. I think assuming is a big thing that happens to a lot of CRPS patients. It's not only just the doctors assuming, it's people around you assuming, and people that don't know you assume. They look at you and sometimes you look healthy. They don't notice the discolored limb. They don't notice anything. Like I went in for an endoscope and the doctor heard my medications and he automatically assumed that I would be a high tolerated patient. So he gave me the maximum dose for sedation and I had an allergic reaction because I'm not a high tolerated person. Just because I'm on high medication, it doesn't mean I'm high tolerated. It just means that's the medication that I need for this condition. And that's, I think, the biggest thing for myself is assuming. If you don't know, ask. If you don't feel comfortable asking, look it up because there's so many people now, and CRPS has already been proven that Social Security is accepting CRPS as a disability. So I think it's important for everyone to not just assume. I think that's my biggest thing.
Yeah.
We fear, or as human beings, it seems that we fear what we don't understand. And people that are educated in an area that can't understand or explain something, they don't want to be bothered by it.
Yeah.
Your label is when it's clearly it's that doctor's insecurity with the fact that they don't know what the heck's going on and they can't help you. So they're going to put it on you. And that's the hard part, is that having that constant, and you're already feeling that brain fog, right? So it makes you question your sanity in a way. Is that this person is supposed to help me and they know the ins and outs as a doctor, right? And they just told me that this is all in my head. So what is real and what's not? And that confusion, all of that stress just makes it exasperates everything.
I think to answer your first question of what uh, we would like people to know, and I think knowing that it's always there, in the sense that CRPS can often be an invisible illness, so other people around you don't see it and don't know it's there. And I tend to be pretty private with personally, I don't talk a lot about it. In my life, I still, even though I go to the doctor so much, I don't, it makes me uncomfortable. But then when I like have to switch to using my mobility aids, it's people forget that I'm always going through this. I'm in a flare right now, and yes, it's worse right now, but just when I'm walking normally or my limp doesn't seem as apparent, it doesn't mean that I'm not always in pain. I don't like to remind people that personally because it's awkward for me. But yeah, doctors forget that too. I feel like that they question why we're still on the medication when I'm able to walk. And it's because we're just used to it. But it doesn't mean, and we're not presenting as in pain, it doesn't mean that we aren't and that it's not there. And yeah, I think people forget that sometimes.
It's very defeating and frankly
Or
somewhat annoying too to remind always.
yeah. I was gonna say for me, I feel like it's for family and friends. I feel like they should know that I'm I don't mean to be like unreliable sometimes, but I feel bad whenever we make plans and we set dates and all this. And then the day of, I'm not able to go because I'm in a bad flare or I just feel horrible. I can't get out of bed. And I just feel like they don't really understand that. Like, they're like, we had this planned out for so long. Why can't we do it? And all this stuff. But it's not really me saying it, it's my body telling me. So I always hate that fact, but I do feel like it's very important to always tell them that it's not that I don't want to go with you. It's not that I don't want to be there. It's not that I am trying to make excuses. It's that my body is doing this to me right now. And the most important thing is to listen to my body.
'Cause they always say, power through it, power
Yes.
through it. Or they say, just don't think about it. It'll go away. It doesn't, it doesn't turn off. What are you talking about? It's like a headlight. It's like a headlight that you're sending, you're trying to turn it off. You're trying to turn off your car. You're pressing the button and the headlight's not turning off. It stays on at all times, even when you're sleeping. It's on at all times. And family doesn't understand that. They really don't. And it sucks.
Yeah,
And they
definitely.
don't understand it's okay to not understand.
I definitely get that. And I feel like my answer to that first question, for me personally, going through so many doctors, it's how many times have you heard going to the doctor, okay, rate your pain on a scale of 1 to 10? Like, how many times have you heard that? Because I think I've heard that a million times at this point, and it's my pain is always there. Sometimes it does flare, but personally for me, I don't have a 10 on a regular basis because a 10 for me is, and it's different for everyone, but a 10 for me is I can't move. I've had a 10 once in my life, and trying to explain to a doctor the feeling that is going through the limb at that point, like the affected area, the feeling, they're like, is it burning? Is it like tingling? Like what's going on? And it's constantly changing. Like it's never gonna be just like the same kind of feeling. And I feel like whenever I'm talking to any doctor, they don't really understand that. They're like, okay, why isn't it just one? They're like, why isn't it just always burning? Why isn't it just always throbbing in pain? There's always going to be so many different changes with it. And I feel like that's something that not a lot of people understand. Some days I might be like sitting down and I can't feel my entire left leg because it's just tingling and it's just numb. But there might be other days where it feels like it's completely on fire. And I genuinely do feel like doctors just don't take that into consideration whenever they're looking at CRPS as a whole. And I really wish that like people and doctors would take that a little bit more seriously whenever it comes to the symptoms route. Because then, whenever you're sitting there and trying to talk to them, you're feeling like invalidated because not a lot of doctors are going to listen to you and actually understand. Yeah, it's really hard. And like the biggest term that I use all the time to explain it to people is I'm like, it really sucks. Like, it's really hard to deal with, and if you don't have a positive and, like, good outlook on it, which is so hard to do, like, you're just gonna keep getting stuck in a constant loop. But I wish that people would understand that it's not always gonna be the same. It's not always gonna be just, like, a constant thing. It's gonna always be there, but it's always gonna be changing.
Yeah. Okay.
Right. And I like how you said that. The running joke in our family is 11 teen. We're constantly at 11 teen. It's not on your scale.
Yes.
You'll figure it out. You'll catch on one day.
Yeah.
Um, so I'm like, or I, Brian will always say that when it's a little bit, when he's like higher than 11 teen, I'm like, oh, it's a bad day.
Yeah.
I will literally start to shake when it's that bad. Like I would legitimately just start to shake. And I think for women too, we are a little bit more tolerated in pain. So
Yeah.
our 11 to 12 to men is they're 20, 25, and we mask it so well on top of that. So I learned going to court is I tell them exactly what I'm feeling. Like I feel like something's burrowing in my elbow. And they have a better understanding because they just sort of like, it doesn't make sense. What do you mean you're feeling tingling, numbness, radiating, hypersensitivity? Oh, you don't have hypersensitivity today. I'm able to touch your arm today. And it's different every day. Does it really, there's not a book, there's not a book on it. They can say that there's different studies, but there's not an actual book that's going to tell you, yeah, you're going to feel this on this day. You're going to feel this on that day. And I think that's the biggest thing for me too, is I hate
Right.
that. Yeah.
That goes in when you were saying earlier, you don't know how you're going to be today or what you're going to feel. And with that pain, like you are talking about, and Beth had brought up about trying to get them to understand the different sensations and feelings and that on that 1 to 10 scale. And I think it's very important to understand that this is not a 1 to 10 scale condition. That's why we use or reference the McGill pain scale, the pain index, because it uses 75 adjectives that's divided across 20 sets to describe the sensory, affective, and evaluative pain components. So you get the big picture of what this pain looks like. This isn't just 1 to 10, it hurts. It's what does it feel like? What other functions of your body is it affecting? I don't know. For you, I get twitches. I get twitches that I don't want other people to see. I have no control over it, and it's substantial. Or my hand, when the cold really affects it. So it just will start doing its thing. And I'm like, one day I'm going to buy a piano. I'm going to put my hand on it and find out what tune it's playing. Because it's just dancing around. And
it's hard when you like this of acceptance of these things that you didn't choose. But then when you have your body just malfunctioning like that and there's nothing you can do about it right in front of your face, it's difficult.
Yeah.
But I don't know if anybody has found like their go-to or their thing that really helps them or has helped a certain symptom that they have or your, I don't know, I want to call it maybe like your comfort go-to or in anything that makes it worse. Any tips that we have out there for our fellow warriors?
I guess it's not like a concrete thing, but I've had it for so long. I've gone through the cycle of, especially when I was younger, pushing myself to the limit and then like dealing with a flare and push yourself to the limit. And so I think my biggest like challenge that I had learning how to live with CRPS and now that I've worked on mastering is knowing my limits. And I think once you get to a place where you know, or at least you better know how to listen to your body and are at a comfortable place to also say no, that has helped a lot because I'm not pushing myself to do something I know I shouldn't be doing. And that comes with acceptance, obviously. And again, I've been doing this for a while, so that this has been a big journey. But yeah, knowing your limit is something that you learn to do, but once you get better at it and you're listening to your body, I think that has helped me a lot in knowing that's some like what I'm capable of doing without a flare. But yeah, it's hard because you have to get to a point of acceptance to do that and to be okay with it and to vocalize that to people around you that you're incapable of doing some things. Like, for instance, I travel with the wheelchair usually now, and that makes my life easier. You had to get over the fact that, okay, I do need this service. I need to be in a wheelchair when like, for instance, if I go somewhere with a lot of walking, like Disneyland, for instance. But then I come away from the day and I don't feel miserable. I'm able to still walk and I'm not in a flare. And it was getting to that point where understanding what my body really needs and what my limits are that I achieved in general a better sense of quality of life. That's my tip. It's the soft skill that you have to develop, but that's what's made my life easier.
Yeah, I think mine goes along with yours in that I personally try to look at things different, which isn't hard at times because I have a neurodivergent mind with the ADHD. But I chose to look at it. One thing first that helped was gratitude because when you're so negative, or for me, when I get really negative, I can't even allow myself to say anything positive. But if I have to do a gratitude list every day and someone's going to hold me accountable for it, it forces me to see at least one positive thing, which eventually changes the mindset somewhat to as much as you're going to let it. So, as simple as it is, gratitude can really make a huge difference. But the other thing that I took was without being unreliable or feeling that you have the limitations and recognizing those and having to tell people and things like that. I chose to look at it like given a unique gift here instead of having to do these things that I feel obligated to do but don't want to do. I get the privilege now of choosing quality over quantity. I only have this much energy. Am I going to go do the thing that I feel obligated to do but don't want to, or am I going to go and do the thing that's going to make me happy or bring me joy or mean something more or be something more important? And when I started to look at things like that, it helps me look at things more positively, that I was just doing the things that I enjoy doing instead. I got that privilege that some people or most people don't even know to think about. So that's really what I based it off of was that quality over quantity after that.
Yeah, one of the podcasts that I helped you with taught me that my day of 10% is my 100%. And I'm okay with that. And I wasn't in the beginning. I thought I always had to give 110%. And no, if you can give 10% one day, that's your 100% because that's what you can give. And doing that podcast really taught me that. It's okay to give 10% one day. It's okay to give 5% one day. As long as that's your 100%, it's okay.
Yes, Quinn has some very helpful
Yeah,
suggestions. He's
he
definitely helped
did.
a lot.
I was way too nervous to talk to him, but yes, it was very helpful to see that point of view. I didn't think of it like that. I thought my 100% was the 100% that I used to give. And it's not realistic. And then it puts you in a mindset that you're not reaching your full potential, but you can still reach that full potential just a different way.
And I think that I've faced that too with myself and with Brian. I'm like, you have so much going on with your body today. The fact that you even got up and came out here for a half hour is huge. Think about the things that you did accomplish today and think about somebody else. Would somebody else be able to do that? We are a strong bunch. That's for sure.
I guess I can piggyback on that too. So mine was like acknowledging my even the littlest things because for so long I've been dealing with it that I just got so used to everything that I had to do. Like I would change things I did. If I couldn't really walk that day, I would struggle. I would grab walls and stuff like that just so I can be able to do things. And then it's not until I got into pageantry that I noticed that when I do all these interviews, I've overcome a lot and that the littlest things that I do, most people are like, That's crazy. Like, that's what you do on a daily." And I was like, yeah, it was just normal to me because that was my daily life. That whenever I stopped and actually thought about it, I was like, dang, I am strong. I do a lot. So it was actually crazy to think of the different perspective and not what I've come to know. So I feel like that really did change my mindset there. Is that when I actually look at things and I'm just so used to doing it my way that I'm like, this is actually crazy. Most people don't do this. So it's actually really nice to think of something from a different perspective and seeing myself from an outside point of view and be like, oh, I am really strong.
Resilient.
Yes.
Resilient. Yes.
And every warrior out there needs to hear that and know that you're strong. You are dealing with something that some people just can't, or you can't even. I mean, people can't even fathom half of the symptoms that we deal with, let alone to deal with that. So as weak as we feel, it's really the complete opposite. In every moment of every day, you're fighting this, and that is, yeah, that's really some amazing strength and courage. And that kind of goes into giving back, being part of the foundation and wanting to help others like that are going through this. And that is courageous. At some points, we're ashamed of symptoms. We're embarrassed. We don't want to talk about it. We don't want to admit it. And so then, having the strength that we have to fight this, you also have your courage because you're here. You're talking about it. You're being open. You want to help other people that are going through it or not to feel alone. And this is where I too want to just implement this because we are all women and I don't want to alienate the men that do have this, right? So we understand it a little bit different because men and women are totally different. And what I've come to notice is that men seem to deal with this differently. My personal opinion, and that's all that this is right here, is I feel as though it's hard for men because they're supposed to be the protector, the provider. They're supposed to be big and strong and be able to defend us and provide everything we need. And when they have something impeding that, their entire purpose of what they are supposed to be is gone. The only thing I could think that maybe women would be able to relate on that level would be is if this inhibited your ability to be a mother. If you couldn't breastfeed your child because of the CRPS. If it took that away from you, it's ingrained in you like that is like those characteristics are in men. And I could be totally wrong because I'm not a man, but that's my opinion on the scenario. I just noticed that it is very different, and I just wanted to make sure that we include them.
Yes, I agree with that though. My own opinion, I feel sometimes I met a friend who has CRPS and he's a guy and I can't just be open about it sometimes. He doesn't feel like he can be open. And it's you can because you're not alone. There's so many of us that are in different parts of our lives that are being affected by CRPS. And that's why I joined the CRPS Foundation, because I was like, I want to help people that are like me, that feel like they're alone, that feel I can't do it, but you can. And the more you talk about it and the more you realize that it's okay to ask for help, I think that was the biggest thing for me, is learning that it's okay to ask for help. It doesn't make you weak. It does not make you less than. It honestly, it makes you a bigger person to be able to ask for help because, hey, I can't do it and it's okay. It's perfectly okay that I cannot do it. I think that's my biggest lesson for CRPS and patience. Be kind to myself, be patient to myself, and understanding that I don't need to do it right now and that it can wait. Just enjoy the now. I think that's my biggest thing for learning with CRPS.
Do you guys feel more, I don't know, comfort or help and support in knowing and being able to connect with other people that have this as well?
Yes.
Yeah.
So
Especially like listening to everybody and knowing, oh my God, I feel that way too. It's just so nice. It's like a breath of fresh air.
I'm gonna say definitely for me, since I got so young, there wasn't really a lot of people around that knew what it was, or I knew anyone who knew anything about it. So now that I'm getting older and I'm joining organizations like this and also for pageantry, speaking out about it, I've had a whole bunch of people come to me and they tell me their stories, they tell me similar things, and I'm like, we're all kind of the same, but yet it's crazy to hear all our different stories and all the same stories, and you're like me, you get it, you understand me.
Especially when we're dismissed and nobody gets it for so long. I think that when you finally find that space and people, you're like, you get it? Are you lying? Do you really get it or not?
Yeah. It's so nice.
Yeah. So I know for me, I've had so many issues in life that I've always just wanted to help people that have been anywhere in the many walks of life that I've experienced. And I finally come here. I ended up here actually before being diagnosed because I had just seen how broken and beaten down this disease had made Brian. And I was on the hunt for anything and anyone that really got it, could help, could be supportive. And it's funny, I went searching for him and I found myself here. And I found my
That's
tribe and
awesome.
all of these amazing people, all of you and everybody else. And it's really changed my life. It's entirely changed my life. It's given me purpose and it's made me overcome some of those hurdles that I never thought I would have the opportunity to do. And I don't know about you guys, but it makes me almost cry. It makes me cry sometimes. It makes me smile from ear to ear other times. Just when you get that email or that message that you help somebody, that somebody is not so hopeless today because of something that you didn't have to do, but you chose to. And I just really, yeah, I really feel that's important. Is there anything that anybody wants to share?
I think I want to say that I'm really proud of everyone that just shows up. I'm really proud I'm proud of all of us to be open and talk about it. It is very hard, and it's great because more people can have an understanding of different views and different walks of life that are being affected by it. So I'm really proud of us. Good job, guys.
I am very proud of each of you as well, and I'm very thankful that you all took the time to meet with me.
I really appreciate all of you and everything you do for the foundation and for Warriors. It takes a lot of courage to stand up and to stand up for something that is hard to talk about. So each of you should know how strong and courageous you truly are. Never forget that. I hope everybody listening enjoyed getting some insight from Warriors themselves. And if anybody has any questions, please feel free to reach out to us. As our bonus episode of the month for CRPS Awareness Month, I challenge everybody to use the last couple of days of this month to really get some awareness out there. Throw on some orange, share an awareness post or CRPS information post on social media. If you do either of these things on social media, please tag us. We'd love to see it, and we'd love to be included, and thank you. And thank you so much for all of your support. It really makes a difference, and it helps us to be able to help Warriors and reach as many as possible. If you would like to support the podcast, please text CWF Podcast to 53555. As always, it's been a pleasure. Enjoy your holiday, and I will see you back on the 1st.